Good morning, everyone, and today I just kind of wanted to give everyone a refresher on Medicare Center. Medicare Center is available to people who are contracted with plan advisors or Integrity and all their sub-affiliates, and you are licensed to do Medicare and Medicare insurance, Medicare Advantage, Medicare supplements, Medicare Part D. And when you log in, if you don't have a login and you are curious and want to learn how to add this to your, list of tools, and you want a contract to do Medicare, you can go ahead and send me an email. But for those of you folks who are already in this system, who have access, this video is definitely for you. So when you log in, this is your dashboard, so to speak. And what I want to cover today is the Medicare apps kind of tool. MedLink allows you to quote MAPD plans, just like this one does. And the CSG app is a way to quote and sell Medicare supplements. Now, each one of these different, I guess you could call them tools, does have the ability to enroll pretty much everything except this one can't do Medicare supplements, these two. But they allow you to look at everything. So it's going to kind of be important for you guys to, when you go into the system, know what this different tool can do for you. Medicare app is going to be the easiest way to kind of quote items or quote Medicare Advantage plans, Medicare Part D plans, send the quote to your client, and also have them or have you assist them in enrollment. And that's what we're going to cover today again. So let's go into Medicare app. When you open up Medicare app, you will see your dashboard and it'll ask you to find clients. So let's go ahead and take a look. There we go. So if you have clients, you can look up clients in this manner by any of these fields here. Or if your client used the link that you have and they have a personal code, then you can go ahead and ask them for their personal code, plug it in, and then it'll populate with whatever criteria, preferences that they put in. But I wanted to just go in and see how to just start off a quick quote for people. So you're going to have to figure out, number one, their zip code. So you click on plans there, like we did here, and it's going to ask you for a zip code. So to make things easy, we'll just go with the zip code of Honolulu. Now it's going to populate here all the available plans that you are able to sell with in this zip code. And for myself, as you can see, these are the plans that I'm licensed to sell. We can go take a look down here. There we go. Now they're also divided in these, I'm going to just call them 3 tabs, because Medicare supplement plans aren't really accessible in this platform. But Medicare Advantage plans without prescription drugs and just simply prescription drug plans are available here. By clicking on this add non-licensed plans, you can see a list of all the plans available in your area. So if you don't have contracts for certain plans, it'll pull up the contracts or the plans that you don't have a contract for. Not licensed. So a good thing you can do here is you can also add it to compare if you wanted to see if there are any other options that might better suit your client, and then see if you can get a contract to offer that plan to your client. That, remember, you can't offer a plan to a client unless you are appointed by that carrier. So it's always safer to click on back to this one, or to not click that add non-licensed plan by clicking here, show plans I can sell. There we go. Yeah, it looks like it did it for here because I don't have other plans. Okay. Yep. It looks like as soon as you click it, it should disable the plans. They just simply disappear. You don't have to refresh or anything. Normally I don't click that button simply because unless a client is specifically asking for like the plan details of a plan I don't offer, I usually don't pull anything up. In addition to that one button that was up there, you can also click on this button. This is the only way you can add D-SNP plans or C-SNP plans to this list, is by clicking on this, and then you'll add on the D-SNP plans that are available. And then this one you can click and it'll disappear. Alright, so from here, let's just pull up something everyone knows. We can zero premium. So if we click on the plan detail, this is a very nifty tool. You actually can get all of the documents. Not only do they have benefits at a glance along with the PDP pricing, you also can get all of the plan documents: the annual notice of change, the rating summary, benefit summaries, benefit at a glance, enrollment book, the application, OSBs, educational brochures, anything that meaning that Humana has that kind of tie into this product, they will have for you, available to just simply click, and it pulls up the most current document. There it is. We're still in 2020, so that's it. Right? So you have everything that an application would have right on your fingertips. And I typically send this to the client. Not the application, but the summary of benefits, the benefits at a glance, star summary. There's a whole bunch of things you need to send, and this is the best way to get the most up-to-date version. Okay, let's go back to the previous screen where we had all the different plans. Now another thing you can do is, let's say you wanted to compare a couple plans. Your client's looking for zero premium, PPO plans. So we're gonna go with zero premium. Well, we don't have any of those, so we'll just compare those two, and then oh, there you go, Ohana zero premium. So when we can click up to 3, and in order to actually do something with it, to actually compare it, you have to click again on the compare now, like that, not on the check mark but on the actual letters, and then it'll show you the differences. So this health cost, remember now, this health cost portion here is an estimated medical cost based on someone who is in the age range of 65 and 69. You can change it based on the age of your client, and when you add a client, add all their demographic information, it will adjust to make this more individual for your client. So this is just a generic, right, just to give you an overlay on how the system kind of works, so that you can get at least a good idea, right? So it looks like, based on this, that United Healthcare has the lowest partial year cost, because this is thinking that you're going to enroll in August, because that's the only available enrollment period. Here in July, you're enrolling them in August, right? And you have to remember, a lot of these plan details, all the plan details will determine how this cost is, and many Medicare Advantage companies can kind of game the system to make this number look small. So just be aware that it might not be the most accurate estimation. Right, so we can compare benefits here, maximum out of pockets, all the different types of office visits, skilled nursing facility, home health care, outpatient. So all of these items here are considered objective. So you can compare these plans like this side by side objectively, because these are set benefits. It's not like saying, like, a non-objective benefit would be saying something like Humana has better customer service locally than Ohana does, or I can help you faster with Humana than Ohana. That would be a subjective item, and you cannot be using that to influence plan members or plan choice decisions. But what you can objectively say is, hey, the prescription drug deductible on United Healthcare is $300, and on Ohana is only $250. So if you have, if that's a concern to you, then I'm going to show you right here that this one's going to be a better option, right? Another thing to think about is the tier, right? You have to remember there is no deductible for Humana's plan up until tier 4, or many other plans like these two, you have to pay a deductible starting on tier 3. Right? So you can view the plan documents here, you can download provider directories, download the prescription and pharmacy directories, and then it'll tell you if there are any additional dental. Now this sometimes isn't correct, and I always check the plan documents when looking at that, looking at the actual enrollment guide, to make sure that the optional add-on coverage is available, because sometimes what this tells you is that they may not have dental add-on coverage available via this type of enrollment. You might have to add it on via their in-house enrollment tool, or some other method. So that's how you compare plans here. Let's go back. In addition to this, you can actually send this to your client by saying add to quote. So if you add to quote, right, so you see up here, we add this plan to the quote, we'll add this plan to the quote, and we'll add, oh, not that one, we'll add this plan to the quote. So we have 3 plans, and now we can send this quote to our client. You can either send it via text or via email, and you can add on a message if you want. All right, make something a little more personal. Hey, Mrs. Smith, we talked over the phone about the 3 plans that will work for you based on the objective information, or however you say it. Probably you don't use the word objective like I do, but based on the things we talked about, these are the 3 plans that I think would work well for you. Take a look here. If you have any questions, let's discuss, and then we can find the plan, hone in on that plan that works the best for you. Send quote to their email or their text message, right? And they can go ahead and access that quote whenever they are ready. Or, like what most of us do, is we go ahead and create some sort of a comparison grid for them, so they can see objectively which plan has the benefits that they are going to use the most, and then they themselves can kind of talk us through different scenarios so that they can feel comfortable with enrolling in the plan that's best for them. Now, in addition to that quoting and everything, there is a way to enroll them on this platform. Now, I am not going to go into that in this video, but we'll do that in the next video, okay? So stay tuned for the next video where we'll use Medicare Center to actually enroll. All right? See you there.